What is a mini stroke and what are the symptoms? A mini stroke is a temporary lack of blood flow into the brain which can resolve within 24 hours. It is also called transient ischemic attack or TIA. Unlike the big stroke, transient ischemic attacks or mini stroke usually last a few minutes. Most signs and symptoms disappear within an hour. A mini stroke doesn't cause permanent damage to the brain unlike the big stroke, but it could be a warning sign of a bigger stroke. We should recognize the signs of a mini stroke in order to get the treatment needed as early as possible. The risk of a bigger stroke to happen is high in the first few days, first few months after a TIA. It is sometimes difficult to identify mini stroke because it can be fleeting. Most of those who experience a transient ischemic attack that lasts only a few minutes are not aware of it. About 35% of people who experience a TIA will eventually have a stroke, and about 50% within a year after the transient ischemic attack. The signs and symptoms of a TIA resemble those found in a stroke. The following are the common signs of a mini stroke. Dysasia, slurring or indistinct speech. He or she may have abnormal and incoherent speech. This happens when areas of the brain responsible for turning thoughts into speech are damaged. Vision changes. People with TIA may experience double vision, blurred vision, color blindness, partial or total blindness. Confusion. The person is disoriented and can't think clearly. They may lack awareness of location or time. He may have a sudden change of emotion such as agitation, anger or nervousness. Balance issues. The person experiencing a mini stroke may be unsteady while standing or walking. They may have difficulty in walking, may or may not fall. Altered level of consciousness. The person may be less alert and may not respond appropriately to the people around. He or she may be temporarily disoriented. They may not be aware of their current surroundings. Dizziness. The person having a mini stroke may feel lightheaded, nauseated and woozy. Since there are other medical causes associated with dizziness, it is important to seek medical attention as soon as possible. Fainting or passing out. The medical term for fainting is syncope. The person experiencing a mini stroke may faint or pass out, which generally lasts for a few seconds to a few minutes. The person may feel dizzy, lightheaded or nauseated before fainting. Severe headache. This is a common symptom for people who are experiencing TIA. This condition causes pain and discomfort in the head, scalp or neck, which can be mild or severe. Weakness or numbness on just the right or left side of the face or body. Numbness and tingling sensations are usually felt in hands, feet, arms and legs. There are other medical causes for unusual numbness and tingling in any part of the body. Everyone experiences numbness or tingling when standing after sitting or lying down for a long time. This usually resolves within minutes. However, one should seek medical help if there is no cause for continuing numbness or tingling, muscle spasm or dizziness. Last but not the least, use the FAST test to check for the most common warnings of a stroke. Face. Smile and check if one side of the face droops. Arms. Raise both arms. Does one arm drops down? Speech. Say a few sentences and check for slurred and incoherent speech. Time. If the answer is yes to any of these, call for emergency immediately and write down the time. When symptoms started,